Hello viewers, welcome to Cafdil Headline. Today we are discussing hepatitis. But how well do you know about hepatitis? Its prevention, do you know it, and its real cause? This and many more is what we're going to discuss on this show. My name is Kojo Arthur. I am the host. I have a distinguished ladies here. I will let them introduce themselves. Let me start off with you, Doctor.
My name is Nadia Pumaya Suleiman. I'm a medical officer at the Cape Coast Teaching Hospital.
And
I am Selassie Abuka, a registered public health nurse at the KEA, Commander Edina Eguafu Abram Municipal Health Directorate.
In short, KEA, Municipal Health Directorate.
Yeah.
Okay, welcome, ladies.
Thank
Doctor
you.
and public health nurse. Like I said, we are looking at hepatitis. We have heard hepatitis so many times, but some of us, especially me, do not know the real cause. But I want you to explain. Let's start off with you, Doctor. What real the hepatitis is? When you say hepatitis, what is it, and the real causes of hepatitis?
Okay, so when we talk about hepatitis, it's simply an inflammation of the liver. And the liver is a very vital organ in everyone's body. It helps with metabolism of glucose. It helps in detoxification of substances. It helps to produce certain factors for clotting in our blood. So then the liver is a very vital organ. So when there's an injury to it or anything that is disturbing it, for it to get inflamed, then that is when we use the term hepatitis. It's an inflammation of the liver. Usually when we talk about hepatitis, people's minds tend to go more to the viral causes, but there are different types of hepatitis or different conditions that can cause hepatitis. So the types or the causes of hepatitis, first is the viral hepatitis. So that's where we have our hepatitis B, hepatitis C. And there are other types of hepatitis. We have the hepatitis A, there's hepatitis D, and there's hepatitis E as well. Those are viruses, so they can cause hepatitis. We also have alcoholic hepatitis. That is from chronic or long-term intake of alcohol. Okay, so that's alcoholic hepatitis. We also have autoimmune hepatitis. When we say autoimmune, we mean that when the body attacks its own cells. So you have the body's immune system attacking the liver cells, and that is known as autoimmune hepatitis. Some other causes of hepatitis are drug-induced hepatitis, where you take in certain substance and then certain substances that cause injury to the liver, and they can be from like some of the very normal medications that we take, but maybe you take them in toxic doses. So certain painkillers, steroids, it can be even some poisonous substances as well. So drug-induced hepatitis, and it causes an injury to the liver. So that's it. But the commonest hepatitis, or what is usually of public health concern now to us, is the hepatitis B. Okay,
Well, I would like to come to we will narrow it to hepatitis B, but which means all the hepatitis, the different types that you've mentioned, they all have way of transmission.
Yes.
Different way of transmission.
Yes.
Oh, okay.
For the others, I've already spoken about what directly causes them. For instance, we know that the viral ones are from viruses. So that one is the transmissible type, where the virus can be shared from one person to the other. But for the others, it's based on what is causing it. So for the viral hepatitis, hepatitis A and E are usually transmitted through food and water. Okay, from food, from water, the infection is
contaminated food.
Yes, contaminated food and water. but almost all of them are sexually transmitted.
Well,
almost all the hepatitis viruses are sexually transmitted. Especially the hepatitis B virus can be sexually transmitted. It can be transmitted through body fluids, which obviously is how it's transmitted sexually. It can be transmitted from mother to child in the birth process. Can be transmitted from mother to child. It can also be transmitted by using through blood, from blood products, infected needles, injections, and all that. Yeah. So basically, or let me say, infected sharps. Yeah.
So the A and C is not common in our setting.
Hepatitis. It's common, but it's not as common as
The B.
hepatitis B.
Oh, okay.
Hepatitis A usually through food and water, so mostly they will come with some gastrointestinal symptoms and all that. But hepatitis B, we see. Hepatitis C, we see a lot of that.
Salasi, do you have anything to add to what the doc said?
Oh, I just want to interject that you've worked out there 4 questions. She has answered about 4 or 5 questions. So are we building up from
Yes.
there? Oh, okay. I just wanted to be sure. Okay, so everything doc says, and then so like she said, we have different types. We have A up to E, and the D is a comorbidity with hepatitis B. So normally when you get hepatitis B, then the D will patch on the B. So normally D and B goes together.
The parasite.
Yeah, it's like a parasite, yes. And then the A and E are foodborne diseases. And one thing about hepatitis is that the liver is powerful enough to resolve some of its issues. So you can be infected with hepatitis, but you wouldn't get any symptoms of the disease. So that is why most times we don't record a lot of hepatitis A, C, and the rest, because like she said, because it's transmitted through oral routes, you might only have gastrointestinal symptoms, and so most times we treat it as a gastrointestinal infection and then it goes away. But the B, because it's common and it's a virus, that is where our attention goes most of the time.
Okay. But what are the risks? Let's, like you said, we are narrowing it down to B. So our concentration is going to be hepatitis B all over. So let me see, what are the risk factors for the Hep B itself?
Okay, so because it's viral and it's transmitted by blood and body fluids, anything that transmits blood from an infected person to a non-infected person is a route of transmission. So let's say unprotected sex is one. So we are looking at the risk factors.
Yes.
So anybody who is sexually active is prone to having hepatitis. Childbirth can bring about hepatitis, where a mother can transmit to the baby. And any body fluid. So yeah, if Doc has something to add.
Yes, so we have like people who use injections chronically, either people who use especially IV injections, who take in injections a lot, people who take in a lot of blood, who get transfused with blood a lot, they are at risk. People who undergo like dialysis and the rest, because it's through blood, they are also at risk. And then we can also any contact with blood or anything that involves using sharp objects. People who maybe take a lot of like they get a tattoo every now and then, always piercing their ear. If wherever you are getting it from, the infection prevention is not optimal. You are at a risk of developing getting the hepatitis B virus. People who travel into countries where hepatitis B is endemic, they are also at risk of getting infected with the hepatitis B virus. So once you are at risk of any of the modes of transmission, not just every child, but a child born to a hepatitis B positive mother is at risk of getting the virus. Yeah, so basically, those are the risk factors.
And I know Doc spoke about injections, but the injections we are talking about here is the ones the drug abusers use.
Yeah,
So
that's exactly what I was going to
Yes,
do. Because
yes.
injections are taken at the hospital.
No. So
And
it's the one.
aseptic
Yeah.
conditions. Yeah.
So they share injection. The needle is shared among.
Yeah.
That is what we are talking about.
And those quack doctors.
Quack doctors, sometimes.
Inject.
Now, luckily enough, syringes and many of them are auto-destruct. So you use them once, you can't use them again.
Yeah.
So in the hospital setting,
It's safe.
it's safe. Injections are safe. Blood transfusions are safe. Everything we use in the hospital is safe. So we are talking about sharing sharps outside the hospital setting or outside an aseptic.
Yeah, in aseptic conditions.
Yeah.
When you say aseptic conditions, what is it? I mean, you mean anything outside the hospital setting or what?
No, anything outside a sterile environment is aseptic.
Yeah.
Yeah.
All right. You kindly follow us on Facebook, Cafdil Cape Coast, and on YouTube, Cafdil Edu. You follow us and you share, like it and share for your people, your friends to also get this opportunity to also learn from this. So let me come to Selassie. What are the signs and symptoms of hepatitis B? Because something must show for someone to know that you are suffering from this disease. So what are some of those signs and symptoms of this hepatitis B that we're talking about?
Okay, so mostly viral conditions mimic bacterial conditions more. So with viral hepatitis, if it will show, first you can be asymptomatic for a long while. So you can have hepatitis without showing any signs or symptoms of the disease. But if you show signs, then it will be flu-like. So you have your fever, headaches, sometimes you have nausea and vomiting, loss of appetite, all the GI tract signs and symptoms. So when you're colder, senior will feel, sometimes when you have hepatitis. Yes. Then at a more advanced stage, when the liver function starts going down, then you start experiencing symptoms like pain in the right upper part of your abdomen, because that's where the liver is located. And this is my right.
Yeah.
So you can experience pain from this region, and also you start seeing yellowish discoloration of the eyes, which we call jaundice. So jaundice can take all over the body. Yeah. Then you can also experience pale stool. So the yellow you get when you poo, you will not get that. So your poo will become like white. Because of the excess bile that is in the blood. Yeah, so those are some of the symptoms that you get. And also because the liver helps in the production of clotting factors, you see that now your bleeding doesn't stop as fast as it's supposed to. Normally with the clotting factors, when you get a cut, the bleeding, you bleed for a while and then it starts clotting and then the bleeding stops. But now you see that you bleed longer and you can start seeing blisters, patches of blood under your skin. Those are some of the signs of hepatitis. We don't have more to add.
So basically, like just a summary. So there are various outcomes of hepatitis infection. Okay, various outcomes of hepatitis infection. When you get into contact with the virus, the incubation period is 1 to 6 months. So incubation period, like contact with the virus and the period with which you begin to see some signs and symptoms of the disease. For some people, so we have acute asymptomatic disease. You've got the infection, but you don't show any signs or symptoms of it. You are just walking around with it. Sometimes you are even highly contagious. Yes. You can be spreading to other people. Then the second one is the acute symptomatic disease, where you've got the infection and you are actually showing symptoms. And then with the symptoms, I think she has mentioned most of them: the loss of appetite, getting tired easily, muscle aches, headaches. Sometimes you may or may not have for some people in the acute symptomatic disease, they actually have yellowing of their eyes, but their disease is not progressed. But you see that they get the jaundice, so then it comes to the attention of health workers that, oh, maybe there's something going on with the liver. Let's do a viral screen. Then they do it, and then hepatitis B is positive. But for most, they may not have the yellowing of the eyes, so then they'll just be going about. And for some people, but in very rare cases, some people are actually able to get the infection and then later develop antibodies to it. So for those people, when you even test them for the surface antigen, you won't even see it. And unless you do the profile, the whole profile, before you see that there's a particular component in the blood that is, I don't want to go too much into that. You see that for that one is showing, but I think most of the time when we do the surface antigen and it's negative, then we hardly do the profile. But there are some people who have the surface antigen negative, but they've had the infection before, and then the body has been able to fight it. But in those cases, in case they do anything that puts stress on their liver, it can easily be reactivated for them to have like an active infection going on. Then we have the progression to the chronic disease, and we have something we call cirrhosis on the liver. Cirrhosis is more or less like scarring of the liver tissue. So it gives the liver this nodular appearance. Usually it is picked up on scan, on ultrasound scan, or from even palpating, like when we touch the patients, and sometimes we're able to feel for the texture of the liver. You can say it's nodular. That one is cirrhosis. That can also occur from the chronic infection. Then it can later develop into a cancer, which we call the hepatic adenoma or hepatocellular cancer. So anyone with a chronic liver disease, when they deteriorate, in the medical terms, we call it like decompensation. It means that your body has been trying to adjust to your liver not working for a long time. But when you decompensate, then certain signs and symptoms will begin to show. So those are where we see some more serious presentations, like you see someone with the eyes yellow, the abdomen is distended. Their abdomen is distended. You can see all the veins on their abdomen. You can see there's a lot of fluid. You see that their feet are swollen, sometimes even up to their knee. That is the latter stages of a liver disease from hepatitis B. It can be from other causes, but for the purposes of this discussion, hepatitis B can also result to that. Their feet are swollen, abdomen is distended. For some of them, they cannot even breathe because of how much fluid they are having in their abdomen. Then the issues with clotting comes in. So then they are at risk of bleeding out easily. They can get infection in the fluid accumulation in their abdomen. Then some at a later part, some of them are at risk of getting hypoglycemia, because as we said earlier, the liver is involved in glucose metabolism, storage of glycogen and all that. So when your liver is not functioning well, it's like now everything that I used to do just keeps failing. Yeah, so that is for the chronic. They can even get some lung, it can even affect the lungs. It's a whole lot. It can, there's buildup of toxins in the blood, which can cause what we call encephalopathy. So you see that the person sleeps a lot, the person is not in the right state of mind, they can even fall into a coma. Those are like some of the very, very late symptoms, but not everyone gets there. There are people walking around with no symptoms. And there are some too with some few symptoms which are manageable. Yeah.
Then hepatitis B is very, very dangerous disease. Yeah, if you don't know all this, now that you are hearing it, and I'm sure you are going to take care of yourself very, very well. It's a new thing to me, all what you're saying. So I was very quiet and shocked listening to you here. So let's see, does it only affect the adults or young people are also do also suffer for this hepatitis B?
And when we were talking about the transmission, you see, we've mentioned babies. So hepatitis is for every age group. You can be exposed at any time, but the children is mostly from birth. Before then, in the later ages, they can be exposed to sexual contact or food and water for the other types of hepatitis, but it cuts across all the age groups.
But for the children, is it common in our setting here?
No, those who are mostly at risk is the babies born to infected mothers. But just to be safe, we are jumping ahead, but just to be safe, because we don't know, it's not every mother that comes for ANC during their pregnancy. We vaccinate all children against hepatitis B in their early years. Within the first year of life, we vaccinate them just to protect them. So, but aside that, everybody is at risk.
Yes, you see, the transmission is, I'm sending you back because it is one thing which is very, very important, and we have to really get the understanding very well. For transmission, I think we combine A, C, B, and stuff. I want you to go back again, then gradually tell us the B, how really is it transmitted? So we will understand it clearly and we stay off certain things. Yes, Doc. I want you to narrow it. Please recap that one, because that aspect is very, very important.
One, so through what we call hematogenously, through blood, and then body fluids. I think that will be the main two.
Yeah.
So it's through blood that the mother will transmit to the fetus in utero when she's pregnant.
Yes.
Then it is through blood that IV drug users, tattoo artists, people with unsterilized needles, injections, and all that will transmit from one person to the other. You get it? Then the fluids. The fluids is what will cause it to be transmitted sexually. Semen, vaginal fluids, menstrual fluid, saliva can all transmit the hepatitis B virus. And this virus is very resistant to extremes of temperature. Cold, heat, is resistant to humidity. It's a very, very resilient virus.
How long does it stay outside?
I'm not sure about that. But I know that it's resistant. I think I saw something like even as cold as -40 something. It can still stay alive. Maybe in an inactive form, but then it can get reactivated. So it's a very, very resilient virus. Yeah. So that is with the transmission. And then of course, sexually, when there's contact, and then maybe there's a cut or something. There can also be transmission by blood. Yeah. So, and to make people know how serious it is, you hear that they usually say that it's 100,000 times more infectious than HIV, the hepatitis B virus. 100,000 times more infectious than HIV. So that's how serious it is, and that's why we should take it serious and try to prevent.
Can it be cured or it's only managed? Selassie.
Okay, it can be managed rather, because
but it cannot be cured.
No, viruses are stubborn to treat. So let's take a disease like HIV. Up to now, we've not gotten treatment for it because it's a viral disease. So viral diseases can only be managed, and the symptoms are brought down so that you can still live your normal life without any complications. So with hepatitis B, you will be given antiretroviral medication to bring the virus under control. And then we also treat symptomatically. So whatever you are presenting at that time, we treat it. So if you are having headaches, fever and all, then we treat the headache, fever and all like that.
Look.
Yeah.
So as she said, when you have the viral, when you test positive for the screening, urine screening, we have the rapid test, which you do, and then you test positive. We ask you, and then we see you at the hospital for the first time. We ask you to do a hepatitis B profile. You do the viral load for us to see how many copies of the virus you have in your blood. The profile is showing, you see, the virus has a structure, and there are some certain particles, or what we say antigens, embedded in the structure of the capsule. So when you get the disease in your blood, some of those antigens can be picked up. So each of them has an interpretation, which makes us see whether it's a recent infection, whether it's a chronic infection, whether the virus is actively replicating or is actively like reproducing itself. So when you bring the profile, we can tell that, oh, this person has tested positive, but the virus is not, you need to be put on the medications, or whether we need to be just observing you. So there are some people who come to the hepatitis B clinic or the hepatitis clinic in the hospital. They are not on any medication. They only bring labs every 6 months. So we look at them and say, oh, okay, your liver function is fine. Oh, your viral load is below this number. You don't need to be on medication. So they just come for checkups. And there are some people whose viral loads were high, and then they've been put on medication. So they also come for follow-up, and then, oh, you're on medication, but your viral load is okay, your liver function is okay. There are some people that we've been like observing for a long time. Everything was fine, but all of a sudden the liver enzymes are becoming high. The viral load is going up. So then we can ask you, oh, okay, then do the profile again. Let's see what is happening. You do the profile. Oh, maybe the virus has become active again. And now the copies is above a certain number. So we'll put you on medication. We do an ultrasound that, oh, the liver is beginning to change. So it's a condition that you have to like follow up on, because certain changes can occur at any time once you have the infection. Yeah.
All right. Let's see. There are certain things that if you treat, or when it is cured, you say it cannot be cured. It can be managed, right?
Yes.
It can be managed. But those asymptomatic people, where they don't show any sign, something can be done about. But can it reoccur? But I mean, I'm talking about the recurrence after treatment. Is it possible?
As in, for those who are on the medication.
Medications.
Being on the medication doesn't mean that you are cured of the infection. for most of those on the medication, anytime they even do the rapid test, it will show positive. So what the medication is doing is just to keep the load of the virus down and to prevent you from transmitting it to someone else or to other people. That's what it does. So you are just on the medication to keep the viral load down so that your disease doesn't progress. You don't develop any cirrhosis, you don't develop cancer or anything, to prevent progression of the and prevent the virus from attacking your liver cells to cause problems for you and to prevent you from transmitting to other people. That's
So,
what
which
the
means
treatment
you are
does.
going to be on that medication for the rest of your life.
Well, yes, to some extent. There are certain, we manage the infection following certain guidelines. In the guidelines, there's a point at which, at a certain point after being on the medication, you can be put off it, but then you will still be followed up 3 months, 6 months. We follow up on you. If you need to go back on it, you go, but most have to be on it for life. Yeah.
How can we then prevent ourselves from all this so we don't fall
This one,
a
I
victim?
think public health nurse should start.
Selassie.
So with the prevention, one, you have to be screened. So like when we were talking about the transmission earlier, I mentioned vaccines for children. So with the expanded program on immunization here in Ghana, the hepatitis B vaccine has been added to one of our vaccines called the pentavalent vaccine. So at 6 weeks, the child will get the first dose. At 10 weeks, and then at 14 weeks, the child will get the third dose of the vaccine. So within the first year, the child is protected, and we assume that vaccine can protect the child until about 20 years of age.
Oh, wow.
Yes. So from there, and when the person starts exposing him or herself to sexuality and being sexually active, you have to screen yourself. And when you screen and you are not positive, then you can take the adult vaccine, which is the hepatitis B on its own. It's just 3 doses. You take the first one. After a month, you are given the second dose, and then at 6 months, you take the third dose. Then after that, you can choose to have booster doses every 5 years, just to protect yourself. Yes.
But here in Ghana, we have certain different perception about when it comes to vaccine. Because take COVID for instance. COVID came and there was this vaccine. There are a lot of people were kicking against it. So how are people receiving this?
Okay, so for the children's vaccines, it has become standard now. So every child in Ghana, so far as you go for your CWC, that's the child welfare clinics, your child will receive the Hep B vaccine. And with hepatitis B in general, even in the adults, it's like the patronage is there because it's one of the vaccines that we pay for in the country. Is one vaccine that the government doesn't cater for. But the adults,
And they pay themselves.
oh yes, you have to pay. So, but the adults patronize. So it's not that difficult. The acceptance for the hepatitis B vaccine is not that hard. But if you don't want to go the vaccination route, then you have to have protective sex because you don't know who you are sleeping with. So protective sex, or we call it mutual monogamy. So I am your partner. We only have sexual intercourse with each other. You won't go outside. I will also not go outside. Depending on the fact that we both know our status, all the statuses you need to know. So Hep B, any of the viral infections, HIV, and all. So that is mutual monogamy. You know that you are not getting any infection from the other person because you are practicing together.
The children, you said they get 3 times. So
Yes.
by the first year, they are done.
Yes.
The adults, how many times? How many doses are they supposed to get?
3.
3.
3. And sometimes it depends on the brand too. So the brand of vaccine. So some brands can order 4 doses. Others can say, oh, 3 is okay. So the common one we have in Ghana is the 3-dose vaccine. So 1 month, first one, then 1 month you take the second dose, then 6 months you take the third dose.
So I take the first one. The second one, I forgot. Maybe 1.5 months later, then I remember that I have to go for my second dose.
Yeah.
Is it still active, or
Yes.
I have to start again?
No, it's still active. So one thing with vaccination is that we only have the minimum duration for the next dose, but we don't have maximum duration. So even if you take the first dose and you forgot for a year and you are coming back, we give you the second dose because it will reactivate what was started when you took the first dose, and then the protection will continue from there. So you don't have to restart the dosage.
Then I was misled because I remember I took the first dose. I forgot. Those people came and we were on vacation. I was so later I decided to go, but they told me I have to start again. I said then we have to. Would you add some small?
Okay, so
the
for
prevention?
the mother to child transmission too, what is done is that during booking, when a woman gets pregnant, booking for your ANC, antenatal care, the hepatitis B is one of the screens, one of the lab tests that is required. And when you test positive, I think from the 2nd trimester, you can start taking the antiviral. Then at birth, there is an immunoglobulin, an injection that is given to the baby. Then the vaccination is done for the baby as well. So that is how we prevent mother to child transmission of hepatitis B. And then aside that, generally people should try and avoid like sharing needles with other people. Make sure that your barbers are sterilizing the tools that they are using. Make sure tattoo artists, whatever, sterilize whatever they are using so that you don't get infections from all these sources. For people who are immunocompromised, like someone who is maybe HIV positive, you have to screen for hepatitis B as well, because your immune system is already depressed, so you are at risk of developing these other infections if you get exposed to them as compared to someone who is not immunocompromised. So you have to screen and then generally take care of yourself. Yeah, so that's it for the prevention.
But Selassie, you are a public health nurse. I don't know what the public health nurse, your quarters, I mean your corner. What are some of the things that you people are doing when it comes to letting people know this? Because it seems the advocacy is low.
Well, we do a lot of works when it comes to these things. For example, with the policy with the government of Ghana now, every child that's going to preschool is screened for some of these things. And then those who are going to the SHS1, we screen them. We have our SHS screenings that we do. So we include hepatitis in all of the screenings, and any case we pick up is referred for further management. So, and also you hear us on radios, on CICs, at the antenatal clinics and all. Yeah, we are around. It's just that our work is plenty. It's, today we are talking about hepatitis, tomorrow is malaria, cholera, plenty conditions of public health importance. So it may seem we are not hammering, but a lot of work is going on.
Yes, a lot of work is going on, but we are not seeing it. We are not seeing it because
every year there's a day set aside for hepatitis, World Hepatitis Day, globally, 28th July.
Must we wait?
Oh, we don't have to wait, but that is when like much attention is given to it. So then there are a lot of programs that go on around that time. But all year round, people speak about a lot of organizations organize health screenings. Always hepatitis B is part of those screenings. If in the hospital, if you are coming to donate blood for a relative, hepatitis B screening will be done. If you are positive, you are rejected. You are not eligible to donate blood to someone.
So if the person is positive, what do you do? What is the next step that you take
after the person coming to donate? So those are the people who are directed to come to the clinic. So they come to the clinic, then we request the labs for them. Then we follow up. If they are candidates to start the medication, we do that. If not, we follow up on them. So those are some of the ways by which we are able to pick infections. Most of the time it's from those going to donate blood. They say, oh, me could donate, I reject it. May say member, those things.
And also we as a people should be interested in screenings. Like once a year, just go and check.
Exactly.
Is it for free?
No, it won't be for free, but it's your health. Like we said, hepatitis B can be asymptomatic for a long while. But maybe by the time you are realizing that you have hepatitis B, you are getting to liver cirrhosis stage. So if you had screened maybe just a year earlier, you would have been saved. Okay, because mostly we will catch you when you come to the hospital, or we'll catch you. We are looking out for the vulnerable groups, children under 5, pregnant women, aged. Those people are the vulnerable groups. But you are strong, walking around. We may never get you. Maybe even if we are doing community screening, you will not come. So if we are health conscious and we be like, oh, this year, let me go and check. Let me check my liver. Let me check my kidney. How are things going? Then you move on from there.
And especially among us health workers, we do this education, but it's like we ourselves, we forget, because we are also one of those at risk of getting this infection, because we come into contact with people every day. We are setting lines for patients. We are like we handle fluids. Like there are a lot of things. You are in surgery with patients. You get needle pricks. So as a health worker, you should also be checking all the time to know whether you are at risk, and make sure that at least you are vaccinated. If you are vaccinated, you've taken your booster, you know that maybe for the next 5 or 10 years you are covered. When that time elapses, you test again. You check your titer levels, you take another booster. Those are some of the things we can also do.
But do health insurance cover in terms of screening and stuff?
No.
It doesn't.
No. There was an advocate for health general checkups to be included, but I don't know if it has been added yet. So that even if you've never visited the hospital, you're on insurance, but you've never gotten sick, once a while you can go and do a general checkup. It was raised sometime, but I'm not sure.
Even the medication, the antivirals are not covered by insurance. Patients have to buy it in their pocket.
So you see, the children, some are born in our villages. How are you able to reach out to those people as well as a public health?
Oh, that is very easy. It's very easy because we have the community-based health planning services, the CHIP zones. So we have nurses in the remotest parts of the country. And even if there is no CHIP zone in the community, the nurse plans outreach clinics to that community to reach the children. So the children are actually very covered when it comes to reaching them with vaccines.
Now let's talk about the potential complications of hepatitis B, especially those who are infected with this. What are those complications?
Okay, I think Doc
we've
has
mentioned
spoke extensively
But,
on
yes,
it.
I want you to re-echo on that because it's very important. See, if the person do not understand or doesn't really know its complication, we may take some things, we are not going to take them seriously. That's why I ask you to re-echo the transmission. Now, I want you to know these complications as well.
So, first of all, even though we mentioned that most people who get infected are asymptomatic, and then there are some who are symptomatic with some mild symptoms. In some very rare cases, some actually go into liver failure when they have when they get the hepatitis infection, what we call fulminant hepatitis. And with that one, once the liver starts failing, the person becomes jaundiced quickly. By the time you realize the person can no longer control their bleeding, their respiratory rate is going down. Like that one happens very fast within a short time, but that is very rare. The one we usually talk about is the chronic hepatitis B infection, where the person has had the infection for a long time. Sometimes they don't even know. So they come to the hospital. The patient is jaundiced. The patient has a distended abdomen with fluid in it, which we call ascites, which can get infected. The person can have what we call portal hypertension, where the person is at risk of bleeding. So the person can either be vomiting blood. The person can be vomiting blood. It also, the same thing causes the swelling of the abdomen, the swelling of the feet, what we call pedal edema. If the liver function begins to go down, they are no longer able to store glycogen as they are able. So these people can go into hypoglycemia, and that can result in fatality. Hypoglycemia. Sometimes I also mentioned the hepatic encephalopathy, where the liver is not able to clear certain substances. So then toxic substances are in their blood, which can go into the brain. So those people, you see that they are somnolent, they feel sleepy, some are confused, some can go into a coma. So those are the possible complications of hepatitis: the liver becoming cirrhotic, the liver failing, and then developing hepatocellular carcinoma, which is cancer of the liver, which can spread to other parts of the body. Hepatocellular carcinoma can spread into the lungs. So there is buildup of fluid in the lungs. The person is not able to breathe. The person is getting a lot of hypoglycemic episodes. It's unfortunate, but some people actually come to the hospital with those advanced symptoms. And now when we do the viral screens, you realize that, he was hepatitis B positive. So then we'll say that you have a decompensated chronic liver disease from hepatitis B infection. So those are some of the things that hepatitis B can do.
We mostly see that swelling of the feet that you mentioned. Is it only the liver that causes that?
Oh no, there are other conditions that cause heart failure. Heart conditions can cause, kidney conditions can cause, even some side effects of certain medications can cause. So it doesn't mean that when you see that, sometimes even from maybe sitting down for long, maybe in a bed, can also cause swelling of the. So not just that.
Because
it's not just that.
I've been seeing this.
But if it's persistent, then you should go to the hospital and get checked up. It could be from anywhere: the heart, the liver, the kidneys, from some medication you are taking or something else. No, it's not just that. But it's just one of the things, because there's collection of fluid. So the abdomen, the feet.
Oh, okay. So here you have a hepatitis clinic.
Yes, at the Cape Coast Teaching
Hospital. That's where you are.
Yes, it's on Tuesdays. Yeah.
Oh, okay. So every Tuesday, so is the number reducing or is increasing? Those coming.
There are always patients to be seen. So I don't think the numbers are going down, but we'll have to check the statistics for that. But it doesn't look like the number of infections are going down because those risk factors are still there. People are not even aware that they have the virus. The infection is active. They are sharing it amongst people. They don't go for health screening. They've not been vaccinated. Nothing. So the infection keeps getting transmitted.
All right. If you really want this program to stay, kindly support us, or you can donate through the number or the numbers on your screen. Or if you want more, you can call the same number for clarification. If you really want this show or program to stay for a very long time, because we have a lot for you. We have a lot for you. If today that you are strong, look at how things are going, and tomorrow when you are sick and down, what are you going to do? So this minimum is what you're supposed to think about. You can follow us on Facebook, Cafdil Cape Coast. When you go to Facebook, just type Cafdil Cape Coast. On YouTube, type Cafdil Edu. Edu is EDU. Cafdil Edu. Share, like, and share for your friends to also get access to this station. You heard Dr. Nadia Pumaya Suleiman, she is a medical doctor at Cape Coast Teaching Hospital, and also Salasi Agboga. She is a registered public health nurse at Commander Edna Eguafo Abrim Municipal Health Directorate. My name is Kojo Ata. Same time next week. Thanks for watching.